You're watching Ketome TV. Knowledge is power.
Now we have a question from Garcia. What are the foods to avoid when undergoing immunotherapy or chemotherapy?
Well, definitely foods that are involved in inflammation.
Okay.
As far as immunotherapy and chemotherapy, they're two different things.
Mm-hmm.
So with chemotherapy, I've heard stories about wheatgrass reducing the side effects of the chemo.
You've heard stories? What does that mean?
Preclinical and patient reports.
Okay.
So there's a lot of those.
All right.
They're not quite.
So you're not
they're
ready to
not
recommend
double-blind studies.
Got it.
But definitely, I've heard a lot of reports. Wheatgrass can apparently have some benefits in reducing the negative side effects, nausea and so on,
immunotherapy?
of chemotherapy.
Chemotherapy.
Immunotherapy, we don't really know.
Okay.
And that's going to be a whole different thing.
But immunotherapy overall is a better tolerated treatment?
Oh, yes, definitely.
Mm-hmm.
Yes, yeah.
Because it's so targeted as opposed to the chemo?
Well, it's using your immune system.
Mm-hmm.
It's harnessing your immune system
rather
than having a physiological effect on the tumors.
So you've started out with saying foods that will reduce or stay away from foods that are involved in inflammation. Yeah, so list a couple of those for us.
Well, once again, plant phytochemicals, cruciferous vegetables.
No, those are good for those are helpful.
Oh, yes. Okay.
What
so
are
you want negative foods. Okay.
So
well, meats,
tell us what to avoid.
Saturated fats, which are found in animal products. Cheeses, meats, acrylamides. Which are a byproduct of barbecuing and cooking, and also are used in the food industry.
Okay.
There's also bisphenols.
Okay.
Which were originally in the Nalgene water bottles, but are also used in the linings of tin cans and so on.
Okay.
So you want to avoid tin food.
Or minimize.
Minimize, yeah. Bisphenols are actually an endocrine effector. So what they do is they can falsely signal like an estrogen.
Okay, right. So that messes with your hormones.
Yeah.
Right. So if you have like a triple positive or ER positive breast cancer or something, you want to be even more mindful of something like that.
Yes.
Yeah. Okay. So meats. Barbecuing or things that kind of cook, burnt
cooked foods,
saturated fats,
processed foods,
anything
processed. Eat whole foods.
Okay.
Make sure you cook it yourself.
All right. And what does the jury say about sugar?
Well, some cancers it's an effective. It's something to you want to avoid. The reason for that is because sugars require insulin to cross the barrier from the bloodstream to the cells. You have your insulin transporters, and when you have more insulin, cancer cells love insulin. It's one of the things that they feed off of. So
keeping the sugar
down keeps the insulin down.
I see.
That prevents cancer cells.
Right.
There's also the Warburg effect, but cancer cells can switch to that regardless of the food source.
What's the Warburg effect?
It was something that came out quite a few years ago, a long time ago, about just about how certain cells use different signaling pathways to recharge the ADP into ATP.
Okay.
Yeah.
So so sugar has an influence on that as well.
It can potentially, yes. I think in cancer, though, that's really come around a long ways, and cancer cells are very creative in signaling and using different sources of energy and so on. So I think the real more direct effect is increased insulin from the sugar.
Right. So we assume the sugar itself is the culprit, but it's actually the insulin that your body naturally releases to try to digest.
Well, also sugar is hard on the body. It requires a hydration shell to exist in the blood.
Okay.
So in other words, it has to have a shell of water surrounding it just to exist in a biological system. It's dehydrating, and it forces, puts pressure on the blood vessels. It bloats, bloats your blood vessels, creates hydrostatic pressure and so on. So it's something you want to avoid in general.
So if you are going to have sugars, which who isn't really, but try to make them naturally occurring.
Yes. If they're naturally occurring, they're locked in with fiber.
Mm.
You know, the sugar that's in fruits and so on. So when you have
So you have less
fruit,
of an insulin response.
well, you have less glucose.
Less glucose.
And so insulin is specific to glucose. Glucose is the most simple sugar molecule, and that's what gets broken down from cane sugars and so on. So when we're talking about sugar, we're referring to glucose.
Okay.
The glucose released by the sugars, the complex sugars in fruits, is very minimal. It's much less glucose is able to be cut out, and that's because these sugars occur in what's called branched chains, the complex chains, and we only have so many enzymes to break down those chains and release the glucose.
I see. So you need sugar. Your brain will die if you don't have sugar. This is bad. So you definitely have to take in sugar. So don't go real extreme here, but do try to keep them naturally occurring in whole fruits and things like
fruits
that.
And vegetables.
Yeah. Okay. Thank you.
Thank you for watching Ketome TV. Subscribe below and stay informed.